and welcome to Vax Facts and FAQs. VFF is a virtual discussion on how to stay healthy and get up-to-date information on the flu and COVID-19. This month, we'll be discussing COVID-19 updates, flu updates, COVID-19 and how it impacts the immunocompromised, the end of the public health emergency, misinformation, and of course, our FAQs. So first, we will talk about COVID-19 and flu updates. The community levels in the U.S. are looking a lot better than they did during the holiday season. Less than 3% of counties, districts, or territories have high COVID-19 community levels. And if you look at Michigan, we are almost completely green. So nearly all of Michigan has a low community level, including Wayne County, Michigan. The recommendations for the low community level are to stay up to date with COVID-19 vaccines, including getting your recommended booster doses, maintain ventilation improvements, avoid contact with people who you may suspect have COVID or have confirmed that they have COVID-19. And then follow recommendations for isolations if you have suspected or confirmed COVID-19, and follow the recommendations for what to do if you are exposed to someone with COVID-19. Additionally, if you are at risk of getting very sick for COVID-19, it's recommended that you discuss additional prevention actions that you can take with your healthcare provider. So this is the flu activity. So nationally, flu activity is low. The number of weekly rates of flu hospital admissions have decreased compared to the previous week. And the CDC continues to recommend that everyone ages 6 months and older get an annual flu vaccine if flu activity continues, or not if, but as flu activity continues. So it's not too late if you or a loved one has not been vaccinated for the flu this year. So it's not too late. We often hear at the fall, September, October is flu season, but flu season is as long as flu activity is. So it's not too late to get the vaccine. And if you do contract the flu, there are antiviral medications that are available to treat flu illness. However, these medications work, they need to be started as soon as possible in order to be most effective. So it's important that if you are susceptible to complications from the flu, that you get into the doctor as soon as possible so that you can start those medications if necessary. All right, so now we're going to talk about COVID-19 for persons who are immunocompromised. The CDC recommends that those who are immunocompromised or have a weakened immune system or live with someone that does have a COVID-19 action plan so that they are prepared for infection if that does happen. But before we get into that, it is important to know that immunocompromised individuals are at higher risk for complications from COVID-19. So if you have a weakened immune system and test positive for COVID-19, it's important that you talk with a doctor to get antiviral treatments, which are available for COVID-19. And like the flu antivirals, it's important that they're detected early. So get in as soon as possible if you do test positive for COVID-19 and you are immunocompromised. So the action plan is basically some preventative measures that you can take and have in your toolkit to be prepared for infection. So one is to get an updated COVID-19 vaccine. This remains to be the best protection against adverse or complications from the virus, and to prevent the contracting of the virus altogether. Another is to improve ventilation and spend time outdoors where possible. So this is like ventilation indoors. So maybe see what improvements you can take, suggest improvements to your workplace, see what your workplace has been doing, but then also spend times outdoors where possible and get some fresh air. Learn about testing locations and treatment options before getting exposed or sick. So this is important because, one, you don't want to be scrambling, trying to find a test location, trying to find where you can get this information as you're concerned and worried that you have COVID-19. So it's important that you find a testing location and know where it is. So if you do contract COVID, you know where to get it beforehand. And then also discuss your treatment options with your provider or your physician, even if you're not have not been confirmed to have COVID. At your next checkup, just talk about the options so that you're prepared and that your doctor's prepared and they'll know what you want to do. Worst case scenario. Get tested if you've been exposed or have symptoms. Testing is a very important tool for us maintaining our low community levels and protecting those around us. So you getting tested lets you know how you need to respond, but it also can aid your loved ones in their response. And of course, wash your hands very often and wear a well-fitting respirator or mask, and maintain distance in crowded spaces. Next, we're going to talk about misinformation and disinformation. So false or misleading information is causing people to make decisions that could have dangerous consequences to their health. And during the COVID-19 pandemic, misinformation has caused people to decline COVID-19 vaccines, reject public health measures such as masking and physical distancing, and use unproven treatments. But this goes beyond COVID. Misinformation about diseases, illnesses, potential treatments, and cures and vaccines, diets, and cosmetic procedures can all be harmful. So what is misinformation and what is disinformation? Misinformation is information believed to be accurate but is incorrect. So it's very simple. But the key distinction between misinformation and disinformation is that this disinformation has the goal of deceiving. It has the goal of providing you inaccurate information. And it's very dangerous. Misinformation is dangerous as well. But again, the impact goes beyond COVID on how we see misinformation and disinformation in public health affecting our populations. COVID-19 misinformation can be hard to spot. And but one way to kind of spot it is to check how you react. Do you feel angry? Do you feel shocked? Is it reaffirming your beliefs? If so, check to see if other valid sources are making similar claims before sharing them online. There's also specific things that you can look for in your sources that can kind of put up a red flag that it could be misinformation or disinformation. So one, video that have been edited to change the meaning, websites that look professional, but the stories are telling are false or misleading. And these are the types of misinformation. Quotations where the beginning or end have been deleted to change the meaning, or misleading graphs or diagrams. And so within these types of misinformation, you can look for spelling errors, anonymous authors, out-of-date information, opinion-based articles or videos. And again, also look at the content itself. If it looks fishy, just try to see if there are other sources, other credible sources that are reaffirming what the original source is saying. And we're going to talk about different sources that you can utilize to try to find the most accurate information possible. So misinformation can come in all forms of digital content. So here's some quick tips on before resharing information. So 1, check your sources with some of the tips I just said. 2, read beyond the headlines. The headlines are designed for you to click. It's clickbait. So if it's not catchy, you won't read it. So read beyond the headlines. Read the first couple paragraphs. Read and see if there's a summary at the end. But the headlines can be deceiving in itself by nature because of what they want you to do. They want you to click. So just read beyond the headlines and before you share. And this is also important because you don't want to share something that doesn't align with your beliefs. So the headline may look like it aligns with your beliefs and sound like it aligns with your beliefs, but the contents could be very different than what the headline suggests. So again, just read beyond the headlines. Verify the facts with government and health organizations. Again, we're about to go over a few health organizations that you can check out when trying to confirm whether information is accurate or not. So sources for credible and truthful information about vaccines include national and international medical organizations, academic institutions, and professional medical groups. And there's also that general rule is like, does it end in .gov, .edu? Usually that means that I won't say usually, that is a good sign that you can explore the source and see if it's credible. Again, you still want to explore every source, especially .edu, because there can be opinion-based articles published on .edu websites. So again, be sure that you're still looking at it with a critical eye, but that .gov, .edu is generally applicable. So let's see. So an example of organizations that you can look for information is the Centers for Disease Control and Prevention, or the CDC, the World Health Organization, Immunization Action Coalition. There are academic institutions and medical groups. It's usually like the Association of Heart Managers or Heart Specialist Organization or things like that. So usually within the medical group name, it's clear what the medical group is. I kind of just made those up off the top of my head, but medical groups and professional associations and work groups are a good source for information. So next we're going to talk about the end of the public health emergency. So the big question here is, does that mean that the pandemic is over? And unfortunately, it does not. I think everybody's been sitting around waiting for these cases to go to zero, but the truth is it's not. The COVID pandemic as we know it is coming to an end. You know, this past winter was the first of the pandemic where we did not experience a major surge of cases. So 2 out of the 5 COVID-19 emergency declarations are coming to an end in early May, May 11th. So you might hear language, and again, it's not true that the pandemic is over and we can just go out in the street and celebrate, but this is not necessarily the case. Yes, the emergency declarations are ending, but this does not mean that the risk of the virus no longer exists or that precautions are no longer necessary. The cases aren't zero. The hospitalizations aren't zero. The deaths aren't zero. The virus continues to be a threat to the US and globally. The virus has the potential to continue to evolve in unpredictable ways. So the monitoring of COVID-19 is going to continue. So even though we are in a much better place, there are people that are at even higher risk, including older adults, immunocompromised individuals, and people with underlying medical conditions. They are all still especially vulnerable. So this idea that the pandemic is over or that COVID-19 is not a risk is especially harmful to that. So how does this end of the public health emergency impact everything? And so how will it affect access to vaccines, tests, and treatments? It's all what's heavy on not only on public health professionals' minds, but as the news coverage continues about this end, it's on the public's mind. So after the end of the 2 emergency declarations, we will still have access to a large federal stockpile of vaccines, tests, and treatments. But then once the stockpile runs out, and again, we have some time, coverage of these resources will likely fall on health insurers and individuals. So if you have private health insurance, you'll widely have so this means that they may no longer be free or widely acceptable because that they are following on health insurance in individuals, whereas before the government was providing all of this stuff for us through the public health emergency. So for people with private insurance, Medicare or Medicaid, COVID-19 vaccines will continue to be free through their insurance, but there is a large gap at this moment. There's no plan for people without insurance and how they will access the vaccines for free. And this kind of goes for home testing as well. You can get tests through your health insurance and Medicare and Medicaid, but if you are private health insurance and Medicare and Medicaid, they might not be as widely available for those who do not have health insurance. So there is a large public health gap in services that can really affect the equity and how we have distributed tests and vaccines due to the end of the public health emergency. And so there's been a lot of conversations in public health on how we're going to address those gaps and how we're going to make sure that people who do not have insurance and other vulnerable people in our population will get these services, because again, the cases, hospitalizations, and death are not zero. And so there is still going to be a need for people to get vaccinated, to get boosted, and to have access to tests and masks and things like that. So more to come, and hopefully that situation can be remedied as we're working towards the end of the public health emergency. And again, we do have that stockpile that we can work through before we are really out of options. All right, so we're going to wrap up with our frequently asked questions. So products online are claiming to prevent COVID-19 that are not vaccines. Non-vaccines products are claiming that they can prevent or treat COVID-19. So where can I report websites selling products with fraudulent claims? And this is a job for the FDA. So the FDA really advises consumers to be aware of websites and stores selling products that claim to prevent, treat, or cure COVID-19. If you have a question about a product that makes these claims, you should always talk to your healthcare provider, and you can report fraudulent claims, products with fraudulent claims about or to the FDA. And if you have experienced a bad reaction to a product sold with those claims, FDA's MedWatch Adverse Event Reporting Program can be utilized to make these reports. And it's really important to know that the FDA is established so that people know what they're taking, why they're taking it, and what it's been proved to prevent, treat, or cure. And the vaccines went through rigorous approval process. And so when you see these options online that are not vaccines, it's important to know that they likely have not gone through the rigorous process to get approved or FDA approved or emergency use authorization that the vaccine has. So please use very high discretion when ordering any medication online. It's important that you talk to your healthcare provider before doing so. If you have any concerns, I would say the best bet is to not buy that option. And if you are looking for a treatment or preventative option or anything, please talk to your healthcare provider. What will boosters look like in the coming months and years? So the FDA has suggested that for most Americans, the booster could be given annually in the fall, like the flu vaccine. I know this has been a conversation that's been in the works since the beginning of boosters for COVID-19. So it's really, I think we're moving in the direction that a lot of people have hoped that we would move towards. And so again, given annually like the flu, and high-risk individuals could still receive multiple doses per year. It's not sure when or formally this will happen. So it's still in the works, but it looks like we're moving towards that direction. On February 9th, the CDC actually added the COVID-19 vaccine and boosters to its list of recommendations for children and adolescents and adults. And speaking of, there has been some tweets circulating suggesting that the CDC should remove these recommendations for children and adolescents and remove it from their immunization schedule. And the question is this true? Should this be an option? And the answer is no. The recommendation should stand, and it will stand, because although children are at lower risk of COVID-19 deaths and complications than other groups, they are still at risk. So, and there's no amount of minimization of the virus or the pandemic that's going to make that untrue. At the beginning of the pandemic, there was a push for equitable distribution. We wanted to make sure those most at risk, which was our older population, got access to the vaccines when there was supply chain issues and distribution issues and all of those things. Now that is resolved. So now there's not really a concern that because you're less at risk, you don't need it. That was never the concern. It was really like the people that need it most should get it right now. So now across the board, the recommendations are there and they're going to stand. Worldwide, COVID has caused more than 17,000 deaths in people under 20. And honestly, children's risk of long COVID symptoms are even more concerning, as with a lot of populations and their infection from COVID. So one study has found that 25% of children and adolescents who got COVID or get COVID experience long-term effects from COVID-19. So again, the recommendation is going to stand for children. And if you see information circulating about how COVID-19 affects children, whether the vaccine is safe for children, I encourage you to speak with your healthcare provider, but then also visit some of those sources that we mentioned in today's presentation to confirm whether the original sources have accurate information. Do they have that clickbait title and that's what we're going off of, or what Twitter's going off of, or are they bringing the facts, and are they citing credible sources when they're talking about children and COVID-19. So these are the things that you can do when exploring this topic. I feel like it's going to be something that we're going to discuss often, children and vaccines. So again, speak with your healthcare provider and make sure you're getting accurate information online. So with that being said, I want to thank you all for watching another Vax Facts and FAQs video. And as always, if you have questions or feedback, please visit the website, nkfm.org, or you can email us at reach@nkfm.org. Thank you and have a great rest of your evening.